Thank you very much for those kind words of introduction. Back home, I'm just known as the guy with the bent nose, which is the only visible deformity. There are others. Anyway, so on with the mission. Thank you very much and welcome to our audience to this sharing of some thoughts regarding a very important problem in caring for older people, which is the syndrome of falls. So I have titled today's talk as Prevention of Falls in the Elderly. And I thought that we would begin perhaps by understanding that fall is a very important problem in older persons. I mean, we know that. Intuitively, we know that. I know that those of our audience who are seniors themselves, those who are caring for seniors, are very well acquainted with the danger of a fall. Now, the World Health Organization, the WHO, estimates that almost a third of older persons experience a fall each year. That's almost 1 in 3 people. And you can imagine the magnitude of the problem. Not just that, the incidence of falls increases as we grow older, which means that above 70 years of age, and that percentage goes up to over 40%. So all in all, the issue of fall is important because even though many falls result in minor injuries, just a moment, problem. I'm hearing an echo. Oh yes, now it's better. Thank you. Many falls, like I said, result in minor injuries, but some can result in really serious injury, causing illness, disability, and beyond. So that's the reason we are talking about falls today. The reason we are talking about falls is because it is a big problem. It increases as we grow older, and the consequences of falls can be pretty devastating. So these are the reasons why we have chosen this topic for discussion today. Now, our aim at the end of this session would be to understand this, which is, let's start with asking, what do we mean when we say fall? Why do older people fall? I mean, anybody can fall, but we know that in older people, the problem is a little more. Why is that? What happens when an older person falls? What should we do when somebody falls? I mean, if we happen to be a bystander, if, God forbid, we happen to be the person who has fallen themselves, what should we do? And finally, the point of the whole exercise this afternoon, how do we prevent falls? So let's get on with the first question. What is a fall? Now, I had intended to show you a small video clip, but for some reason, this video clip is not really working. I mean, I kind of tried it out, but it's not really coming on. Now, the meaning of a fall is a very simple, intuitive meaning. It just means coming to rest on the ground or at a lower level inadvertently. And that's the important thing. Not like if I voluntarily sit on the ground because somebody is feeding me a nice meal, seated on the ground, that's not a fall, even though I have come to rest on the ground. But when that happens inadvertently, I don't want it to happen, and it happens, that's when we say that it's a fall. So while all of us understand what we mean when we say fall, this is the meaning. This is the answer to the question, what is a fall? So moving on to the second question, why do older people fall? Now, to answer that question, let's take an actual situation. On the screen, I've described a fairly common, perhaps, situation seen in a hospital, which is Mrs. X, let us say a 75-year-old lady. She visited the hospital to see the doctor. She has tremors, which is a little vibration of the hands. She has a high blood pressure. She has a bit of diabetes. She finds it difficult to walk. her knees ache. Now, if you look at our older population uh, with us, we find that these are fairly commonplace problems. High blood pressure, a little bit of diabetes, they take tablets for it. She finds it difficult to walk because her knees ache. Okay, so she came to the hospital. She saw the doctor, and the doctor said she was actually doing well. He reassured her, he gave her a prescription for some medication, and she leaves the hospital. And then, unfortunately, she has a fall. Now, if we work our way backwards from the point at which Mrs. X had a fall and ask ourselves, why did she have a fall? I mean, why did this lady actually fall? Perhaps she walked ahead and she didn't see a small step that was there. And because she didn't see the step, she tripped and she had a fall. In fact, at that point, somebody shouted out, "Madam, be careful." But she didn't hear, because probably her hearing was a little impaired. And because of that, she missed the cue and she tripped and she had a fall. Of late, she is finding it a little difficult to hold tightly onto the railing. On top of which, sometimes the knees don't bend like how she would like them to bend. Many older people, especially the older old, that is after 70, 75 years of age, their grip is not as tight as they think that it ought to be. The knees don't listen sometimes. They don't bend like how they used to bend. And so what happened? Unfortunately, she thought that it would bend. She didn't, and then she tripped and she fell. She feels, in fact, she's becoming a little unsteady. And this is a feeling she's been having. She didn't necessarily report it to the doctor because she thought that, yeah, I'm an older person. People do get unsteady when they're old, and she didn't think it important enough to report. Her daughter, in fact, has been telling her she should use a walker or a stick. But somehow she feels it's not yet time to use a stick. What will people think? Or a walker, worse still. That makes me look old. So for whatever reason, she's not using something which might have prevented her from falling, and so she had a fall. Now, the hospital corridor has been freshly swabbed. The floors are wet. The mop has been left on the floor. Not only is it a slippery, wet floor, there is an impediment there, and she didn't see it perhaps, or the mop is in an angle that she kind of didn't see it. She tripped over it and she fell. The doctor, in fact, recently has changed her medicines, and the previous ones had made her feel a little sleepy. She used to feel a little drowsy, and that effect, her previous medicine she took last night, in fact, even this morning before she came to the hospital, and it makes her feel a little drowsy. She was not at her best as she was walking, tripped and fell. In fact, when she got up from the chair after seeing the doctor's consultation, she felt dizzy. Now, these are all various reasons why older people fall. I haven't enumerated all the reasons why people fall, but these are common reasons why older people fall. Maybe it's a problem with vision, maybe with hearing, maybe it's a grip and a strength problem, maybe it's a joint problem, maybe it's an unsteadiness, dizziness problem. Maybe she has been told to use an assistive device like a walker, but she hasn't yet started. Maybe it's an environmental thing. The floor is wet. There is clutter on the floor. There is something, she trips and she falls. Maybe it's a medication-related side effect. Whatever. These are all common reasons why older people fall. Okay, now if we look at this person once again in the situation in her house, and we look again at this question of why she fell, what is it that we actually come up with? Probably, I'm just translating what I said earlier into issues which we can probably address. If a person has a visual problem, a hearing impairment, muscle weakness, arthritis, walking difficulty, unsteadiness, now many of these things can be dealt with. It's not that all of them, just because somebody is old, we must say they do have visual problems, they will have hearing problems, they will have weakness, they will fall. No, it's not necessarily true. So it's up to us to try to identify these issues as being potential issues which we can actually deal with. Now, this is the other set, which is not using a stick, floor is slippery, there's clutter on the floor. In other words, these are probably environmental and behavioral issues. And finally, of course, the healthcare or the illness issues. Fall in blood pressure when you stand up. How many of us, when we stand up, sometimes transiently feel slightly woozy for a few seconds? Now, when you grow older and older, that wooziness can become a problem and, in fact, may lead to a fall. Side effects of some medicines and actual neurological disease. So these are common reasons why older people fall. Like I told you earlier, a fall is a situation where one comes to rest on the ground or the lower surface inadvertently. Okay, so now what happens when an older person falls? Now look at that diagram. That diagram is a sort of a pie chart on the consequences of fall. Now the good news is that in about 13% or 1 in 10, nothing really happens, in the sense that a person just picks himself or herself up and keeps going. Nothing much has happened apart from a slight jolt. Another big percentage, 62%, suffers some form of an injury. But that injury is not an injury which leads to a bone breaking, which happens actually in about a fourth, which is a fracture. So what happens when an older person falls? Well, nothing in many cases, but sometimes an injury or a fracture. Now, if you go beyond that and look at, for the lady, what happens following a fall, an injury, and a fracture, Mrs. X will find it difficult to walk about, will find it difficult to move. In fact, she gets very scared that she will fall again. And she becomes even more hesitant to walk about and gradually becomes a little withdrawn from social interaction. And that is not a good thing for an older person. Now, for her caregiver, what are the consequences? What happens when she falls? Expenditure on healthcare. All of us know that when a person falls, it requires treatment. And that treatment doesn't come easy, doesn't come cheap. In many cases, hospital bills being the kind they are these days, expenditure on healthcare can become a real problem. Now, if the person after the episode of a fall is not independent, requires bed rest, requires stay in a seated or a lying down position, maybe we need to hire somebody to look after her. And that's another big issue on its own. Right? So all of this may ultimately lead to an admission to a facility. And that's not something that we really want for our older population. So what happens when an older person falls? Well, an injury in almost 62% of cases, and a fracture in a further 25%. Now, if you add those two, it's almost 87% of older persons will have some form of an injury. And for that person, this could be what happens. For her caregiver, this could be what happens. Right? Our next question. What should we do when an older person falls? Now, again, let's look at it from two perspectives. The person who has fallen, what should that person do when the person falls? First, do not panic. I cannot overemphasize the importance of this, because it is very commonplace that when somebody falls, there is a big hoo-ha which happens not only from the people standing around, but from the person himself or herself who panics and gets into a bit of a state. So the first thing is to realize, don't panic. It's likely to be all right. Remember, falls are not necessarily life-threatening always, though the injuries sometimes, if they're on the head, if they're on a vital part, can become a serious issue. But many times they're not life-threatening. They're just an injury which needs treatment. So don't panic. First, continue lying down. Check yourselves. See whether the face, the neck, the arms, the hands, the torso, the hips, the legs, gradually, because many times we know that an older person at night goes to the bathroom, and perhaps unfortunately has a fall. And there is nobody at that point around her or him. So that person at that point can check himself or herself down, your face, neck, see if anything has happened. Next, try to get help. Maybe crawl to the nearest mobile phone, a light, a chair. If there is another person we can call out to, this is the time to call for that person. And then try crawling to the nearest help point. And when help arrives is when first aid ends. Now, another thing that can be done is to, while the person is on the ground, turn over gradually and go on the hands and the knees if there are no injuries, because that will help the person to crawl and move forward at least to the point where there is a phone or a light or another person. Now, for the caregiver, like I said, when you reach help is where first aid stops. Now, for the caregiver, again, don't panic. First and always speak reassuringly. Now, I again cannot overemphasize the importance of this, because there is a tendency on everybody's part when somebody has fallen to gather around that person and start to sort of panic themselves and say, what happened? Oh my God, she's fallen. Oh my God, oh my God. And that raises the temperature and the pitch of the situation. So the thing to do is not to panic, speak reassuringly, call for help, family member, neighbor, and if it appears serious, an ambulance. As the person continues to lie down, loosen the clothes if they are very tight. If there is a belt which is very tight, loosen it. Make that person as comfortable as possible. Check for an injury, just like we said, face, neck, arms, hands, torso, hips, and legs. If the legs are okay, raise them about a foot or 2 feet above the ground on a pillow or other support. Now, this is a general first aid principle. When somebody has fallen on the ground, even if a person is giddy, faints and falls on the ground, generally, if the legs are okay and there is no injury, raise them. What that does is simply pulls the blood back into the central part of the body, and it helps to maintain the circulation and the blood pressure. If there is injury or bleeding, compress the wound with a clean cloth. All of us know that when you press a wound which is bleeding, it helps to stop the bleeding, or at least to control the bleeding. Apply ice around the wound. Ice itself is an acronym for ice, compression, and elevation, which is what we must do when somebody has a limb injury. If unable to move a limb, do not force movement in the limb, and of course, get help. So, this is what we should do when an older person falls. For the person who has fallen and the bystander, remember the first step. Don't panic. Speak reassuringly, call for help, try your best to see how the situation can be eased as much as possible, but definitely try to get help as soon as possible. Next, how do we prevent falls in older people? So, now always remember that, and what the dictum that we say is an ounce of prevention is worth a pound of cure, which means that we must try to see that our older population does not, rather than trying to ask the question, what should we do when a person has fallen? We must ask ourselves how we can prevent an older person from falling. Now, I'd like to think of this in 4 levels. First level is at the home. The second level is in the bathroom. I'd like to focus on the bathroom because the bathroom is the scene of the crime in a lot of cases. Third, the healthcare. And fourth, with respect to lifestyle, diet, and activity. Now let's go over them one by one. At the home level, what are the things we must do to prevent an older person from falling? We must be careful with the threshold and our steps in our house. Always remember that thresholds are a cultural part of many houses where we have a sort of a wooden bar across the door. Now that does help in keeping out pests. It does serve a lot of useful functions, but it can also be a place where an older person can trip and fall. Steps, if they are there, must be highlighted with, many times we see in these public places where steps are highlighted with a bright fluorescent margin. Now, why that is there is for the older person to see the edge of the step much easier. If the step is in a dull brown or a dull gray, chances are that they may not see the step and therefore may trip and fall. Lighting must be good. This is not rocket science. It's just simple things. Floor must not be slippery. Handrails when needed. Now, handrail, when we come to the bathroom, is also a very important part of the fittings in a bathroom of an older person. But a handrail is an important thing even in the home. Many persons have to climb 3 or 4 steps. Now, if we can put a handrail on the side of those steps, it makes a lot of difference. No loose rugs on the floor or durries, because they bunch up. And it's very easy for us to trip on a rug or a durry on the floor and trip and fall. Similarly with clutter and wires. Now, the bed and the chair, the height of the bed and chair must be such that it is easy to get on and off. Now, that doesn't mean the bed should be very low, because when the bed is very low, an older person finds it difficult to stand up. So it should be at the height at which it is easy for an older person to get on and off. And if pets are there in the house, be careful. Pets are a great thing. We all love animals, but a pet coming in and out suddenly when there is an older person walking around can prove to be a bit of a problem. Now, in the bathroom, a well-lit bathroom, the light switch must be easy to find. Many times, a person in the dark looking to reach the bathroom does not find the light switch, because the light switch is inside the bathroom. So it's sometimes difficult to switch on. Grab rails and bars in the bathroom. No high shelves where somebody has to reach for something like a cake of soap. A non-slippery floor. There is again a tendency for us to wet our floors a lot and mop them and leave them wet. Now, it's fine to mop a floor, but a floor after mopping must be dry, because a slippery bathroom floor is a dangerous situation. The toilet seat, raising the toilet seat is a great assistance that we can do to our older population, because it's very difficult to get up from a low bathroom seat. And we must again be careful with the mat and the rug outside. Now, in the healthcare situation, now this is mostly us in the healthcare profession, we must remember that we routinely must ask our older people if their vision and hearing has been checked in the recent past. We must look at the medications. The doctor must see all the medications that a person is on and ask himself or herself, does this person really need this medication? And if there is dizziness or unsteadiness, we must get our older person to report it. Like I said earlier, sometimes older people think that these things are normal aging issues and they don't report it. But we must encourage that even the slightest thing reported. Let's try our best to do something. It may be that it is difficult to treat, but even then, we must report it. Joint pain and arthritis. The number 2 cause of morbidity in older people is musculoskeletal disorders, number 1 being visual problems. Now, the mind can also play a role in fall. Depression, poor mental status can be a reason for a person to be a little lackadaisical about their environment, and they can fall. Excessive forgetting and memory impairment and the gradual setting in of cognitive impairment and dementia, that could also be an issue. Feet, we cannot again overemphasize the importance of checking the feet of older people and seeing how the feet are. Do they have sensation in the feet? Are there wounds on the feet? Is the footwear good? Does it grip well? Is there a back strap? Is the bottom of the footwear worn out? All these questions are important in trying to prevent a fall in an older person. And as far as lifestyle, diet, and activity of the older persons themselves are concerned, a stick and a walker, always remember, for an older person, a stick is a far better thing to do than a fall. Now, for an older person who feels embarrassed using a stick or a walker, we must gently remind them that a fall is a far worse consequence. It's okay. Nobody is going to judge them for using a stick or a walker, but a fall is a bad consequence. Now, 30 minutes per day of physical activity is important at the intensity that is comfortable for the older person, probably challenging them just a little bit, which means that if you can walk slowly, walk slightly faster than slowly. You're challenging your body, and that helps in building muscular strength. Once or twice weekly. Now look at that small picture. It's rather small, I know, but there is an older person there using a dumbbell. In fact, we had a visiting professor of geriatrics in St. John's, and he put up a slide where there were these elderly ladies lifting dumbbells. And so everybody said, yes, 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 of course, older people lifting dumbbells. And the man said, the point about this picture is all those ladies you see are above 90. So it is never too late to develop muscular strength. If you can do it, muscular strengthening exercise at least twice weekly is an important part of maintaining physical activity. Exercise for balance, Tai Chi, I do not profess to know very much about it, apart from the fact that I've tried it once as a demo in a conference, some conference or the other. They made us also do it, and I was very impressed with it. Unfortunately, I didn't carry on with it. I probably will at some point in time. It's a lovely set of exercises which are very good for improving balance. Your physiotherapist, of course, is the person to turn to. Smoking and alcohol, impact on bones, impact on many parts of the body. Calcium, present in dairy products and greens. Vitamin D supplements help in bone strength. Now, the last 3 points here are directly at musculoskeletal and bone. So these are 4 levels at which we can try to prevent falls in older people. I'm almost done. I'm revisiting what our objective of this session was before we open it to questions. In this session, we wanted to say what a fall is. Like we said, it is coming to rest inadvertently on the ground or at a lower level. Why do older people fall? We saw a host of reasons why older people can fall. If you go from top to bottom, it could be vision and hearing, it could be dizziness, it could be unsteadiness, it could be a frailty, which is lower muscular strength, it could be environmental issues like clutter, tripping, not seeing a step, rug on the floor, slippery floor, not using a walker, not using a stick. So many reasons why older people fall. What happens when an older person falls? Well, if we are in the lucky 13%, nothing happens. But not all of us are guaranteed that place in the sun. Unfortunately, we may belong to the rest of us who actually suffer an injury. And worse still, the 25% for whom a bone breaks. And when an older person falls, we know that there are consequences on the older person and the caregiver and the household. So what should we do when an older person falls as first aid? At the level of the older person and the caregiver, don't panic. Try to see in a calm way what we can do. And of course, try to reach for help as soon as possible. And finally, how do we prevent falls? At 4 levels, we looked at the home, the bathroom, healthcare setting, lifestyle, diet, and activity. So with that, ladies and gentlemen, I am pausing here. I will stop sharing this, and I will hand you back to our organizers to moderate the question and answer session.